The interest in ketamine has increased due to its effect on hyperalgesia and opiate tolerance, use in chronic pain state, potential neuroprotective effect, increasing popularity of total intravenous anesthesia, the availability of the S isomer in some countries. It also has antidepressant effect. Ketamine is the racemic mixture of two isomers, R and the S. The S isomer is 3 to 4 times more potent as an analgesic with faster clearance and recovery, and with fewer psychomimetic side effects. It can be used for the induction and the maintenance of anesthesia. Pain management and sedation. First, we will discuss the induction and the maintenance of anesthesia. Ketamine has cardiovascular stimulatory action due to the release of the catecholamine. Thus, it is desirable drug for the induction of anesthesia in unstable cardiovascular patients suffering from hypovolemia, hemorrhagic shock, or cardiovascular depression that is seen in the sepsis. Ketamine is a strong analgesic and it also has bronchodilation action. Thus, ketamine is an excellent choice for induction of anesthesia for the patient with reactive airway disease. The trauma patient with extensive blood loss are typical candidate for the rapid sequence induction with the ketamine. Patient with septic shock may also benefit from ketamine. But one should keep in mind that this cardiovascular stimulatory action is due to the release of the catecholamine. Ketamine has intrinsic myocardial depression action. So in the situation if the trauma or the sepsis has caused depletion of the catecholamine store, before the patient arriving in the operating room, in such situation, use of the ketamine may causes the cardiovascular depression. Other cardiac diseases like the cardiac tamponade, reactive pericarditis, these cases are well managed with the ketamine, as it preserves heart rate and the right atrial pressure via sympathetic stimulation. Ketamine can also be used for the patient with congenital heart disease, especially in whom there is right to left shunt. Ketamine has been safely used in the patient with malignant hyperthermia without any resultant hyperthermia or other adverse effects. Ketamine combined with propofol or midazolam can be given by the continuous infusion to produce satisfactory cardiac anesthesia for the patient with valvular and the ischemic heart disease. We can use the combination of ketamine with benzodiazepine or ketamine, benzodiazepine and the sufentanil. These combination attenuate or eliminate the unwanted tachycardia and the hypertension and also the postoperative psychological derangements, along with profound analgesia, dependent amnesia, and uneventful convalescence. The use of propofol plus small dose of ketamine also has gained increasing popularity for the total intravenous anesthesia technique for the patient undergoing non-cardiac surgery. The advantage of these combinations are maintenance of stable hemodynamics and minimal ventilatory depression when allowing spontaneous ventilation. Pain management. Postoperative pain is a major concern for many of the patients. Nowadays, multimodal analgesia is gaining the popularity. It combining various analgesic agents that act through different pathways and it act very effectively to maintain the postoperative pain. Ketamine is increasingly used as one of the constituent of this multimodal analgesia therapy. Even use of small dose of ketamine 20 to 60 mg intraoperatively decreases the postoperative analgesic requirement by 33%. This small dose of ketamine decreases the opioid use, also the opioid induced side effects, mainly the PONV. It improves the analgesia. As the dose is smaller, the psychomimetic side effect of ketamine is also minimal. Ketamine can be used effectively for pain management via the epidural or the caudal route. The dose is 0.5 to 1 mg per kg. The ketamine should be preservative free as the preservative of the racemic mixture is potentially neurotoxic. Ketamine is also useful for analgesia after extremity fracture for its favorable hemodynamic effects and the conservation of respiration, and it is strong analgesic. It can be used intravenously, even intranasally. The action of ketamine on the opiate tolerance and the hyperalgesia combined with its direct analgesic effect has led its use in chronic pain states. Ketamine may be effective in the treatment of cancer pain, chronic peripheral and the central neuropathic pain, phantom and ischemic limb pain, fibromyalgia, complex regional pain syndrome, visceral pain, and the migraine. Ketamine can be used for perioperative sedation in combination with benzodiazepine or barbiturate. Ketamine can be used as a supplement or an adjunct to regional anesthesia. thereby extending the usefulness of primary form of anesthesia. Ketamine is increasingly used for the short and the painful procedure in the emergency department. The dose is usually between the 0.1 to 0.6 mg per kg. Ketamine is also considered for sedation of the patient in critical care unit because of its combined sedative and the analgesic properties and its favorable effect on hemodynamics. Ketamine can even be used safely in the head injured patient when they are adequately ventilated. Ketamine is particularly suitable for sedation of the pediatric patient undergoing procedure outside the operating room. Pediatric patients have fewer adverse emergence reactions than adults, and these features make the use of the ketamine in pediatric patients more versatile. Ketamine has been administered by intravenous, intramuscular, transcutaneous, oral, nasal, and rectal routes. Ketamine can also be used epidurally or intrasecally when it is preservative free. An oral dose of 3 to 10 mg per kg generates a sedative effect in 20 to 45 minutes. For sedation, ketamine may be given in an IM dose of 2 to 4 mg per kg. When orally it is given 6 mg per kg, it provides optimal condition in 20 to 25 minutes. Intranasal administration has an onset closer to that of the IV administration. For induction of general anesthesia, the dose used is 0.5 to 2 mg per kg IV or 4 to 6 mg per kg IM. For maintenance of general anesthesia, the dose of the ketamine is 0.5 to 1 mg per kg IV with nitrous oxide 50% in oxygen, 15 to 45 microgram per kg per minute IV with nitrous oxide 50 to 70% in oxygen, and 30 to 90 microgram per kg per minute IV without nitrous oxide. For sedation and analgesia, the dose is 0.2 to 0.8 mg per kg IV over 2 to 3 minutes and 2 to 4 mg per kg IM. For preemptive or preventive analgesia, the dose of the ketamine is 0.15 to 0.25 mg per kg IV. In addition to its other clinical uses, ketamine has been used to successfully treat severe depression. For this clinical condition, the administration requires close monitoring during the administration and extensive post-administration observation. The antidepressant dose of ketamine is 0.5 mg per kg, that is given as a 40 minutes infusion. This often results in dramatic mood changes within a day. These changes last for 3 to 12 days. A maintenance dose every 2 to 4 days may lengthen this effect. The precise mechanism of action of antidepressant effect of ketamine remains unknown.